Good morning. It's great to be with you today virtually. My name is Stephanie Nichols. I'm a psychiatric and substance use disorder pharmacist and an associate professor in the UNU School of Pharmacy. I see patients at Maine Medical Center with my fourth year Doctor of Pharmacy students. I'm excited to be here today to present why words matter. So I like to start with quotes, and specifically quotes from people in long-term recovery. So these are a couple of quotes I gathered during Maine's first opioid summit that occurred in the summer of 2019. And these quotes center around the impact of stigma. So one person said, "Hearing you already had your one chance is hard. Recovery after the first try is very uncommon. Look at smoking, which requires 13 to 33 times. And somebody else said, "The idea of once a junkie, always a junkie is devastating." These are real people in our state that are talking about their experience with stigma. So, okay, we know that individuals may feel that they have negative experiences with stigma, but does it actually translate to clinical outcomes, right? What are the impacts of stigma on patient care? Well, before we even get into patient care, let's think about stigma in general. We know that substance use disorders are some of the most stigmatized conditions worldwide. And we know that when somebody finds out that somebody else has a substance use disorder, perhaps somebody who is a coworker, a neighbor, a family, or a friend, that's going to impact those people see that person with a substance use disorder. And we also know that many people still consider substance use disorders to be a lifestyle choice rather than a disease or a disorder. We know that by healthcare providers, patients are treated differently when they have a substance use disorder. So healthcare providers tend to have lower expectations for positive health outcomes and reduced hope. Providers often experience resentment, frustration, and even countertransference, which can result in and contribute to provider burnout. Also, we know that people who experience substance use disorders have worse substance use disorder treatment outcomes. Patients who experience substance use disorder related stigma tend to have reduced motivation, which makes them less likely to accept and engage in treatment, and reduced treatment adherence, which makes the patient more likely to drop out of any treatment programs. And then finally, we know even caregiver attitudes from caregivers who are not healthcare professionals also have major impacts. So we know that caregiver attitudes towards people with substance use disorders have been shown to be important in driving patient outcomes. So the impact of stigma on patient care is real, and it comes from many, many different angles. So we'll do a quick exercise here. So what are these things? Dandelion. Yeah, clover. All right, we've got a violet. We're getting a little bit harder maybe. This one is a hard one for me. I can't remember the name, but this is another thing that grows, and these grow in my lawn, right? But they're all, maybe if they grow on our lawn, maybe we call them weeds, right? What is this? This is a rose. This is also a flower, right? These are all flowers, but we don't tend to call a rose a weed. Why is that? Words are really important, right? If we care for something, if we care for a plant, we're going to call it a flower. But if we want to kill it, which sometimes is the case with some of these other flowers that we started with, then we might call them a weed, right? So words are really important. And these are plants. You can imagine the impact of words when we're speaking about humans. So some terminology to consider, some potentially stigmatizing terminology, and then more preferred terminology. So addict, what do you think would be a preferred term to use? Yeah, a person with substance use disorder. That allows for person first language and uses DSM terminology to, again, continue to normalize the medical component of these diseases. Substance abuser, person with substance use disorder, or if it's somebody who doesn't have a substance use disorder yet, but uses either medications or substances non-medically, we can say that. This again uses person first language, DSM-5 terminology, and also removes the term abuse from substance use, which is important because many people we now realize with a history of physical, emotional, or sexual abuse go on to develop a substance use disorder. So removing that term is incredibly important. Thinking about urine, clean or dirty urine, negative urine screen, positive urine screen. If it's positive and it shouldn't be, unexpected results that include X, Y, and Z, right? Removes judgment, removes any inference that the person is dirty. And then junkie, we already talked about that one. Person with an opioid use disorder for the same reasons we've talked about. A few more. So somebody who's an IV drug user, how about a person who injects drugs? PWID, right? Again, person first language, substance abuse, substance use disorder, or non-medical use of medications or substances. Against medical advice, preferred to leave or preferred to go home. Getting rid of that judgment. It's all about connection, engagement, maintaining a strong rapport. Alcoholic, person with alcohol use disorder for the same reasons that we've talked about. Medication-assisted therapy, medication for addiction treatment, or medications for opioid use disorder or alcohol use disorder, which continues to normalize substance use disorders as multiple multifactorial diseases that are treated with medications, like medications for diabetes, for example. So there's a bunch of other terms and words that you want to consider moving away from because they have been shown to be stigmatizing. There's a complete terminology list located at the website listed here. This is a dictionary that was partially developed by Dr. John Kelly, and you can see his picture down here on the bottom of this slide as well. So I encourage you to check this full dictionary out. So I'm going to leave you here with 5 rules to avoid stigmatization. Use person first language. That is number 1. Number 2, don't conflate substance use and substance use disorders. Often non-medical substance use can lead to a substance use disorder, but not always, and those are not the same thing. Use technical terms with clear and simple language, like a positive or negative urine screen. Avoid using sensational or language based in fear, which can be perceived as inauthentic from people with substance use disorders and continue to build barriers. And then finally, avoid perpetuating drug-related moral panic, which can further marginalize rather than engage people with substance use disorders. And as I mentioned earlier, connection is the name of the game here. Thank you very much.